Health Overview and Scrutiny Committee meeting. We'll move to the first item on the agenda, which is to appoint the chair. So could I please take nominations for chair? Councillor Bradburgh?
Yes, thank you, Laura. I'd like to nominate Councillor Liz Mage as the chair, as she's an excellent chair. So,
thank you, Councillor Bradburgh. Is there anyone that would like to second that?
I'll second it, Laura.
Lovely. Thank you, Betty. Thanks, Councillor Rhodes. And can we just have a show of hands that everybody is in agreement? Lovely. That's carried. Over to you, Chair.
Okay, thank you, Laura. And we move on to the Deputy Chair then. And I'd like to propose that Councillor Colin Hutchinson is Deputy Chair, as he's an excellent Deputy Chair. Could I have a seconder, please, for that? Councillor Blackburn. All right, thank you, Councillor Rhodes. Thank you. Are all those in favour, please show. Thank you, that's carried. Thank you very much. Right, we move on then to membership of the committee. We have a couple of apologies from Councillor Ryler and Councillor Andy Nichols. Are there any other apologies?
Unreceived, Chair.
Okay, thank you. Minutes of the previous meeting. If we go to the minutes of the previous meeting and go under health inequalities and prevention, page 3 of those minutes under the resolved, the further information regarding impacts and outcomes in relation to the different key area of the programme that has been received and has been circulated this morning actually to members of the committee, and reports be adapted to clearly identify the contributions being made to support health inequalities across the population. That will be hopefully actioned for that next meeting when we see the reports coming through for that. Under the item West Yorkshire Urgent Care Service Review, we said we'd like further discussions at a meeting and a summary report be shared with the committee about a broader range of methods used to gather feedback, and we are expecting that to come through within the next few days. And workforce priorities, those actions are currently being worked on at this moment in time. Does anybody else have anything on the meeting minutes? No? Okay. Do we all agree them as a true record? Yeah? Yeah. Thank you. Yeah. Thank you very much. Okay. So now we move on to declarations of interest. Does any member have any declaration of interest they wish to make at this time? Councillor Blackburn.
Yeah, thank you. Just to let you know that I'm an elected governor at the CHFT.
Okay, thank you. Anybody else? Councillor Coates.
Yeah, I'm an elected governor at Bradford Care Trust.
Okay, thank you.
Not sorry, appointed governor, not elected.
Okay, all right. Thanks, thank you. And are there any others? No, thank you. If there's anything that comes up during the meeting, please complete the usual form. Public deputations and petitions, we haven't been notified of any public deputations or petitions for the meeting. So we move into non-emergency patient transport services. And I wonder if officers who are here for this item could have their cameras on, please. We were expecting Simon Rowe, Andy Simpson and Chris Dexter. Yes. So who's leading? Is it that you, Simon?
It is, yes. Good morning, Chair. Good morning, everybody. For those who don't know me, I'm Simon Rowe, one of the Assistant Directors of Contracting for the West Yorkshire Integrated Care Board. Chris, would you like to introduce yourself before I introduce the paper, please?
Oh, Chris, you're on mute.
Sorry, novice mistake. So Hi everyone, good morning. I'm Chris Dexter. I'm the Managing Director for Non-Emergency Patient Transport Services for Yorkshire Ambulance Service, so across the whole region, but also including West Yorkshire.
Thank you, Chris. So if it's okay, Chair, I'll just introduce the paper in terms of the broad themes, and then I assume take matters from there. So this paper concerns the national eligibility criteria for non-emergency patient transport services and how best across West Yorkshire we can implement the national eligibility criteria. National eligibility criteria or guidance for eligibility criteria for patient transport services have certainly existed since 2007, for which is cited within the paper. And before the publication of the national eligibility criteria in 2022, there was a preceding national review of non-emergency patient transport services that recommended and found many things, one of which was that there were significant variation in local eligibility criteria being applied across different parts of the country that wasn't necessarily warranted and therefore justified. The national criteria, as summarised in the paper, and I would want to work our way through this, what the national criteria supports. So if you have a significant mobility need, you are eligible for patient transport. If you are travelling to and from renal hemodialysis, you are eligible for patient transport. If you have a medical need, or in its broadest sense, that means it's unsafe for you to travel to and from your appointment, therefore you will be eligible for patient transport. If there's any concern on your individual safety, then again, you would be eligible for patient transport. That is at its very broadest sense, and there are points of criteria within that, but I wanted to start at that point to say the national criteria is about determining who is eligible, and they are the very broad themes within that. If an individual, for whatever reason, wasn't eligible against the national criteria, we do have the ability to implement local eligibility criteria to determine additional people that would be eligible to receive transportation, and we're currently working our way through that. But equally, if an individual wasn't eligible for patient transport, but they were of a low income or they had a qualifying benefit or tax credit, they would be eligible for what's called the National Healthcare Travel Cost Scheme. That's a means-tested, nationally defined scheme that I would certainly like to potentially, as we go through our presentation, talk about what we're trying to do to make that scheme work better for us locally. But just as a very broad point of view. So if, say, for example, if you use me as an example, I travel to a hospital appointment and I pay for my transportation there and I qualify under the Healthcare Travel Cost Scheme, then I can seek financial reimbursement on the day from a cashier at a hospital site. Or if the cashier isn't available or the site doesn't have a cashier, then I could submit a postal reimbursement form to gain money back. When we've looked at that, we actually think we can make that process simpler and easier for individuals who qualify under the Healthcare Travel Cost Scheme. And that's in two regards. One is around NHS bought bus tickets. So we've managed through the West Yorkshire Combined Authority to negotiate bus ticket prices that are not £5 but £3.30. We can look to do, we're looking to see how we can implement that. Also, as well, looking at our volunteer workforce across West Yorkshire and how they potentially can take people to and from their appointments where needed at a reimbursement of 50p a mile. So that's 45p in terms of the HMRC rate, and then the additional 5p because there would be a passenger in their car. So in summary, the national eligibility criteria is the national eligibility criteria in the sense of the recommendation is to implement that to minimise the variation that exists and has existed previously between various local parts of the country. It's about how best we implement so that we're ensuring that the criteria for patient transportation meets the needs of our local populations and commuters, that we've also recognised that the Healthcare Travel Cost Scheme, whilst we can't change the means tested criteria, we can change the method of operation locally for us, and I can give some further examples on that if people so wish. That's it, therefore, for an overall summary, if that's okay, Chair. Thank you very much for listening.
Okay, Chris, do you want to come in with anything from the ambulance service side of things before I open it up for questions?
I think my role today really is in terms of support and to be able to answer any sort of questions which are sort of more detailed in terms of perhaps bookings and process. I think there's just one thing I would add to Simon's summary, which is this has been done in alignment with the other two ICBs in the region, which has that desired outcome of having a consistent eligibility criteria in West Yorkshire, South Yorkshire, and Humber North Yorkshire as well.
Okay, Simon, can I just double check then that what you're saying is that you would go to the national, you're looking to go to the national criteria because you currently have some things locally that are outside of that national criteria, and you have a service in Bradford as well. If you're looking to go to the national criteria, how do the things that are outside the criteria in the Bradford service fit in? If you could just quickly
Yeah, sure.
outline that, and then I'll open it up for questions. Thank you.
Yeah, sure. So thank you very much for that, Chair. So what we had preceding the formation of the Integrated Care Board, the West Yorkshire Integrated Care Board, is we had some clinical commission groups that had decided on their own criteria and some that had got some degree of consistency. And to put it into rather short, blunt language, one CCG in West Yorkshire had their own criteria that was different from everybody else, and that was Bradford District and Craven, because at that point in time, they were their own legal entity. That's what they could do. As part of the national review basically says, well, why should the area that you live in determine the eligibility criteria that you're subject to? Here are the national criteria with the safeguards that I've mentioned around significant mobility need, renal hemodialysis, and so forth. But what we wanted to do was check and ensure that there weren't anybody that's going to be missed if we move from the local eligibility criteria to the national. Hence, that's why we haven't implemented it straight away. We've actually gone through this process of checking. One, because we had that variation within West Yorkshire already, as the Chair has correctly identified. But number two, we wanted to absolutely make sure, and continue to want to absolutely make sure, that there isn't any unintended consequence of moving to the national eligibility criteria. And equally, we do recognise on a separate point that the healthcare travel cost scheme, from our point of view, doesn't work as well as it could do for individuals and local communities, because it relies on having a cashier on site, or it relies on having the money in your pocket to then wait 2 or 3 months potentially to get reimbursed through the postal form. We think actually for our existing NHS budgets, we can actually bring that money forward and prevent people either having to be reliant on a cashier on site or reliant on being able to wait 2 or 3 months for them to be financially reimbursed.
Thank you. So I'll open it up for questions then now. So, Councillor Hutchinson.
Thank you, Chair. Having spent a couple of years on the West Yorkshire Transport Committee, I'm very aware of the unreliability of a lot of our public transport services. Similarly, in Calderdale, which I represent, there is a large rural hinterland of rural communities very badly served by public transport, and even with franchising, that's not likely to improve any time in the near future. So it's the practicalities of people from these areas seeking, who require healthcare, that I'm concerned about. And whether, if people are having to take 2 or 3 buses to actually get to and from the appointment, do we have the ability to make sure that the appointment times that they're given for outpatient clinics, for example, actually take that into account, that people aren't being given a 9 a.m. appointment when there's no buses that will actually get them to that appointment. Some trusts operate a one strike and you're out, so that if you don't actually make that appointment, then you don't get sent another one. And you're discharged from care and you have to start the whole rigmarole of getting your GP to refer you again. And similarly, if people are, a large amount of the surgery that's done is a same-day admission. It's on a same-day admission basis. So if you're going to have your operation is scheduled for the morning, then you have to be in the hospital by about 7:30 in the morning to actually be processed and have that surgery carried out. If it only takes a couple of patients who can't actually make it to those appointments for it to have an economic impact on the trust, because they've got a fully staffed operating theatre ready to go and nobody to operate on. So the national